Good afternoon, everybody. My name is Craig Cohen. I'm a physical therapist.
And I'm Brittany, also a physical therapist, and we're here at Integrated Physical Therapy.
And today we're going to go through some exercises that you can do if you're thinking about having a knee replacement, if you've had a knee replacement or any other knee surgery coming up in your near future. We've got Tony here, my dad. He's going to help us out with some exercises to show us what to do if you're thinking about having that type of a surgery. So the exercises that we're going to go over in this video are intended for you to be able to follow along with us as we show you them here on this video. What you're going to need, simple towel right here, a stretch strap to help you out, a table if you've got one. These can also be done on a bed, preferably a floor. And the idea is here to increase the strength and range of motion of the leg prior to surgery so that if you choose to have it, you'll know what to do right afterwards. So the first one we're going to start with is called a heel slide. Very simple exercise that we do to increase range of motion of the knee. And Brittany's going to show us how to do this exercise. We're going to use the, go ahead, sorry.
Okay, so I'm going to take the strap just in case you need a little bit of extra help pulling that knee towards your, or pulling that foot towards your butt. So I'm going to strap this up, Tony. I'm going to give this to you to hold in your hands. And then I'm going to have you start to bend the knee. Okay, and then you can use that strap to get a little bit of extra pull. You're going to bend it as far as you can, bringing that heel in towards your butt.
That's good.
Good. Once you start to feel like maybe a little bit of stretch or even just before that point of discomfort, then you're going to hold it there a couple of seconds, let that tissue stretch out a bit, and then slowly release and let the leg go back straight.
Slide along the table.
Perfect. So we're going to go for 10 of those. So take it back in for number 2.
You can hold up a little higher on the strap here. That might be a little easier on your shoulder as well.
Good. Get to that point where you feel a little bit of a stretch. Hold there a couple seconds. Nice and slow. Bring it back out. Okay, and then during all of these, we're going to that point of restriction. So if you just move it within that available range, you're not going to get any progress as far as the knee bending goes.
We do have our team mascot here. This is Toby. Toby likes to get involved in all of our exercises. So he's just making sure that Tony's doing the exercises perfect.
So keep going with those.
Keep going here. Go ahead and heel slide for us. Bending the knee, sliding the heel, maintaining contact with the surface, whether it be a table, a floor, or a bed. Perfect. And then slide it back out. Now, Tony's got great range of motion in his knee right now. Being an athlete his whole life, he's able to achieve that. Imagine if you had some discomfort in the knee, if you're planning on having any type of procedure, you're having any type of discomfort in the knee, you want to be able to, like Brittany said, just bend to that point of resistance, hold it for a few more seconds there, and then release all the way down. So go ahead and bend that, coming all the way up until you feel that point of resistance.
Okay, and we've got 4 more here. And another thing to consider, that if you are definitely going ahead and getting the knee replacement and you have a surgery date scheduled and you're good to go, then you can push the range a little bit more, because the more bending that you have in that knee before you go into surgery, the easier that it's going to be to heal after. If you're not so sure where you lie yet, you haven't talked to your doctor, then you can pull back a little bit as far as the stress on the bending goes.
The knee is an interesting joint. Anytime you have any inflammation in the joint, this type of assisted range of motion can help reduce the swelling in the knee joint, because as you bend and straighten, the nature of the way the joint is designed will help to push fluid out of the knee. It's a active assistive, or in this case, a passive range of motion to the knee. Is this 9 or 10? We're going to go with 10.
Okay.
All right. So once we've got some good range of motion in the knee, the other thing that's extremely important to do is to make sure that we have access to the quad muscles, the muscles in the front of the leg. So a quad set is just that, a setting of the quadricep muscles, trying to engage those muscles. Because if you do have the surgery and after any type of an injury, any fluid in the knee will prevent these muscles from working well. And the idea is to wake them up. So what we'll do is we'll place a small towel under the knee.
Okay, so go ahead and bend for me. Good.
And down you go. And the goal here is to push the knee down into the towel, making a nice tight muscle in the quads. If we can hold the toes up and reach the heel away from you, what we'll do is create a lengthening or elongation of the leg, getting a nice quad muscle going on here, pushing the knee down into the towel. We're going to hold that contraction there for 3 to 5 seconds, and then relax.
And I don't know if it's hard to see from the camera, but you can really see this muscle when it's engaged. As Tony goes and pushes down, that muscle tightens up around the knee, and it's basically you're getting your knee as straight as you can. So the whole goal in having this towel underneath is you almost have the opportunity to lift that lower part of the leg, if you have full extension, off the table. And holding that contraction, making sure that there's a good, nice, solid squeeze here. There's no fibrillation or shaking of the muscles. That's what our goal is with these.
5 seconds. And in the beginning, we're gonna do 10 of these. Very simple, very easy. Go ahead and make another tight muscle. Reaching the heel out away from you, even if you can lift slightly off the table to get to that full extension. There it is. Reaching the heel out away from you, creating elongation through the leg, 3 to 5 second hold, and then come back down. Again, the reason why we do a 3 to 5 second hold here is we want contraction, relaxation, and then re-engagement of that muscle to be able to work.
And you can control how hard or soft you push that knee down into the towel. So if it's super painful in the beginning, if you're working on a stiffer knee, then you might just want to slowly start to squeeze that muscle, just push down into the towel roll, but don't force through anything that's super painful. As you do a couple of repetitions and you're holding, that can start to loosen up. It can get a lot easier to lift the foot up and straighten out that knee.
Show us what a 50% contraction might look like. There you go. So we're not fully engaged. We're about 50% of the way engaged. Toes are still up. Leg is still lengthening along the table, the surface that you're on right here. But we're not fully engaged yet. And maybe the next repetition, it's 60%, 70% until you can get to that full contraction. With that heel lifting, but also lengthening. That's excellent.
You got him here.
So we lost track of the counting, so we're gonna move on to our third exercise here, which is an ankle pump. And the idea of the ankle pump is just to get range of motion in the ankle and the foot to help the muscle activate to push the fluid from the lower part of the extremity back up into the hip, to the recirculation into the heart, back throughout the rest of the body. So what we're gonna do here is just with the foot, we're gonna pump up and down, up and down.
And I put a little towel just underneath the ankle because it gives you that space to move the heel. If you do it straight on the floor, it's not wrong, or straight on the table, it's not wrong, but it's harder to move the foot around that way. So this just gives you that little bit of leverage also. It also elevates the foot a little bit, so if you want to put it on something even higher, if you have a lot of swelling, you can do that as well. And anything where the body part is elevated above the heart, that's going to help bring the fluid back up towards the body as well.
So here's just a little bit of a larger pillow. Same thought process, we've elevated a little bit higher. Rule of thumb is 3 feet above the heart because we want to be able to circulate the fluid back towards the heart, and gravity is a wonderful assistance for that. We can also do circles with the ankle, more with the ankle than with the knee, right? And we do it in both directions because, again, what we're trying to do is use the muscles of the lower leg to push the fluid back up towards the heart. Good, and we can do 10 of those up and down and 10 circles in each direction. So just to review, the first 3 exercises, pre or post surgery, that you can start to do to get yourself ready: bending the knee into a heel slide, straightening the leg out by using the towel underneath the knee as a quadricep set, and third is the ankle pump to get you ready.
Okay, so our next exercise, we're going to start out with that stretch strap again. I'm going to put it around Tony's foot here, and we're going to be going into a hamstring stretch. So go ahead and bend this knee for me, and that's just going to help take some pressure off your back, so it makes your body in a little bit better of an alignment. When you pull the stretch strap, if yours has handles, you can put it in here. If you're using a belt or something else, just whatever you can get leverage on to work your upper body as little as possible. Go ahead and bring that leg straight up for me. Good, and you're gonna go just to the point where you start to feel a stretch, ideally in this part of the thigh, so right above the knee behind the leg. Feeling a stretch there? Mm-hmm. Okay, and then once you get that stretch, we're gonna hold for about 30 seconds and repeat that 3 times on the same side. What you wanna look for here also is making sure that the leg stays nice and straight. So if you're noticing that there's a lot of tension, you can actually pull the leg a little bit further away from you. So go ahead and relax that a little bit. Good, straighten the leg, push that knee straight, there we go. So now you're gonna get a little bit more into that hamstring, and it's okay if it's not all the way toes towards your nose. Once you start to feel that stretch behind the leg, you're stretching. That's as far as you need to go. When you hold it for that 30 seconds, each repetition should get a little bit easier, and you might notice that you're able to bring the leg a little bit further back towards you. Okay, so we're gonna keep holding there about 10 more seconds. Try and take some nice deep breaths, and with every exhale, see if you can soften any of the muscles that might feel a little tight. If you're working really hard in the upper body, like I said, Tony's doing it perfectly. He's got his hands close to his body. He's making everything here really easy. Okay, and then slowly go ahead and come out of that. You don't have to put the leg all the way down unless you feel like you need to take a break, but then you're gonna pull it back up for the second stretch. Good, and then same thing here. You're just going to the point where you feel that stretch. Don't need to force through anything. The second that you start to feel it, you're stretching. And that feels okay for you? And back feels okay in this position as well?
Okay.
So for the sake of the video, we're doing it all on one side. It's okay to do it on one side, but you can probably benefit from doing it on both sides. So if you want to take that extra time and just hit the other leg, you might as well do it since you're already here. Okay, and about 10 more seconds there. And when you come out of the stretch, you want to move nice and slow the same way that you came into it. So whenever you're stretching, if you really quickly let go of the leg and you get a fast release, your muscle's almost going to act like a slingshot, and it's going to tighten back up after. So anything that we do, we're moving slowly into the stretch, we're moving slowly out of the stretch, and that's super important to get the most mobility behind the leg. Okay, and last one here. And it does look like that leg's getting a little bit higher up. Is it starting to feel a little bit more flexible?
Yep.
Awesome. Okay, and then remembering that this knee is just staying bent the whole time, and that's just to help protect the back. Okay, and then nice and slow, we can come out of that one. Perfect. And if your knee's not getting as straight, remember if you're closer to knee replacement and you're lacking that mobility there, you just do what you can. As long as you feel that stretch through the back of the leg, that's all we're looking for. Okay, I'm gonna take this strap for now. And now we're gonna go back into the strengthening a little bit with a straight leg raise. So exactly like it sounds, that first exercise we did where we engaged that muscle above the knee, I'm gonna have you do the same thing here. So Tony, go ahead and pretend like you're trying to squish the knee down. Okay, well, that's okay, you're one step ahead of me. And then after you squish the leg down, you're gonna do that and just lift the leg straight up. Good, and you're trying to keep that leg as straight as you can. If yours isn't that perfectly straight, that's okay. But really getting that muscle engaged first before you do the lift is what's super important. And then nice and slow, controlled as you lower down. Good, same thing. So you'll notice here that the toes are up towards him. That's gonna help engage that quad muscle, the muscle right above the knee. And then also when you go to lift, it keeps that muscle engaged throughout the whole lift. Knees bent here also, so we're just protecting that back. So it's the same thing when we're doing the hamstring stretch. We're gonna go for 10 just like that. Okay, and do you feel these muscles working as you're going with the leg? Perfect. Good, and everything is slow with control and intention. Doesn't have to be absolutely perfect, but as long as you're feeling like that muscle is engaged, you're keeping the leg as straight as you can, that's what we're trying to do. Okay, let's get about 5 more there. Okay, and since we did that hamstring stretch first and you kind of got that mobility behind the leg, now it's a little bit easier to get more range. If you don't do the hamstring stretch first, then this is going to be a lot harder to lift up because you're going to have a lot more soft tissue restrictions behind the knee. Good, and last one here. Perfect. Okay, now we're gonna work the muscles that are on the outside of the hip, your hip abductors. So for the purpose of the video, we're gonna do it with Tony's right leg. Obviously we've been using everything on the left leg, but I don't want his backside to be facing you guys. So go ahead and turn onto your left side for me. Now I get to appreciate the backside. Okay, so you need a pillow or are you okay there?
I'm good.
Okay, so you're gonna keep that bottom knee bent and the top leg is gonna straighten out. Perfect. You wanna try and keep those hips stacked one on top of the other. So go ahead and actually roll forward a little bit. There we go. And then you're gonna lift that leg straight up and actually come back a little bit towards me without letting the hips rock back. So if you put a hand on this end of the table, then you have a little bit more leverage to hold your body there. You wanna keep those hips one on top of the other. Don't let them roll forward, but keep your leg in this position. Perfect. And you'll also notice that his foot is turned in a little bit. That's exactly what we want. So we don't wanna have the toes turned up towards the ceiling. And then go ahead and slowly lower down. Good, and then lift back up. And where you want to feel the muscles working is really that back pocket area. So if you imagine where you had a back pocket kind of just behind the hip, that's where you should feel those muscles getting engaged. When you hold at the top, you want to hold just long enough to feel those muscles and then slowly lower back down. Okay, and how's that feeling for you?
Good.
No pain, right?
Mm-hmm.
Beautiful. Good, so this is number 3. And what he's doing is perfect here. He's holding it at the top. He's getting that muscle to engage at the hip and then with control, slowly lowering it down. So not letting the leg plop back down after you hold it up. Perfect. As you start to fatigue, if you notice that your body is kind of rolling back, take a break in between. You don't need to do all 10 consecutively. Rest for a minute, readjust, let those hips come forward. Good, and then continue again. Awesome. So let's do 3 more nice and slow like that. And where do you feel the muscles working right now?
Which way?
Okay, so right on the outside of that hip, so that's perfect. That's exactly where we want it to be. Good. And 2 more here. Good, last one. You'll notice that Tony's not putting his leg all the way down to take that rest in between. Depending on the strength of those muscles, you might need to put the leg all the way down in order to rest. If you want to put a pillow in between your knees so that you don't have that huge crossover, you can do that as well. But every time that the leg is down, you get a little bit of a rest. Okay, and then last thing here, go ahead, take it back onto your back for me, Tony. So we'll switch back over to that left side again, and we're gonna work on a hip flexor stretch to open up the front of that left hip. So if you wouldn't mind scooting towards the edge of the table as far as you can there. Perfect. I'm gonna put that strap right around the foot. Okay. And then we're gonna let the leg come off the table first. Good, so he's keeping that opposite knee bent, also super important for the back. And the first thing we're gonna do before anything else is just let that leg come off to the side. And the goal would be, before you even start to bend the knee, just to feel an opening or a stretch through the front of the leg. So do you feel any stretch right there?
Mm-hmm.
Okay. With the strap on the foot, now you can take it into your hands. So hold a little bit higher up or lower down, I guess. Good, you're gonna super gently start to bend that knee, and as if you're bringing your heel towards your butt. Okay, and once you feel that stretch anywhere from the hip to the knee, you're in the right spot. So let me know when you start to feel a stretch.
Mm-hmm.
Okay, and then we're gonna hold that there for 30 seconds. So a lot of times what's gonna happen is that leg is gonna wanna lift up. We really wanna try and keep the knee either equal to, if not below the hip, because that's gonna help get that extra bit of a stretch right there. Okay, so we're doing the same kind of dosage as we did with the hamstring stretch. We're gonna hold about 30 seconds. Then after we come out of it, you're gonna move nice and slow, go into the next one, not forcing through any restrictions, just getting to the point where you feel a stretch, and once you feel the stretch, you're stretching. Okay, so take some nice deep breaths as well. Good, and then as you relax a little bit, you can give yourself some slack with the strap. And then we're gonna go into it 2 more times for 3 rounds total. If just having that leg hang off the edge of the table is enough, then that's fine. You don't even need to add the knee bend until you're ready. But once you feel a stretch, like I said before, you're stretching. And anywhere from that hip bone to the knee, you're getting that right muscle. Okay, last one, nice and slow, relax out of it a little bit. Good, and then last one, super gentle. Perfect, and you'll see even with just those couple of repetitions here that he's able to get a little bit more bending through the knee. Probably initially was feeling the stretch earlier on, and then with each repetition as it starts to loosen up, you're able to bend more, get more of a stretch through that tissue. And still feeling the stretch in this thigh?
Yep.
Good, and we want to come out of the stretch nice and slow, no slingshots. Perfect. And then you can bring that leg back up onto the table.
Hi there. Again, my name is Craig with Integrated Physical Therapy. I'm here with my dad, Tony. We're going to do some knee exercises, phase 2. The first ones we did were the prep to get knee range of motion going, get some muscle activation. And now we're going to put those exercises that you did in our first video series into some functionality. So the first one we're going to do here is a mini squat. Now the ones that I want to talk about here, safety is first. So even though we're doing a mini squat, we're going to put a chair behind us here. I've got a pillow on the chair so that I'm going to ask Tony to do a little squat. He's just going to touch the pillow with his butt. He's going to stand back up again. But in case he loses his balance, he's got the safety of the chair right here. He's also wearing shoes so that he's not going to slide in a pair of socks. So the first thing we're going to do here is we're going to do 10 mini squats. As Tony goes into his mini squat, we're going to have him reach his arms out in front of him for some balance transfer. And we're going to have him bend the knees into a mini squat and then come right back up. On the top of the squat, I want to lift the chest and squeeze the tush muscles so that your chest bone and your sacrum, the hip bone here in the back, are parallel with each other. So let's do another 9 here. Up, squeeze, and down. Excellent. And as Tony's doing this, he's going to work the muscles all through his lower legs, specifically his tush, his quads, his hamstrings, really finishing each repetition all the way through. That's 8 right there. Here's 9, big squeeze on the top, and here's 10. And if you notice, he didn't sit, but if he needed to, he had the opportunity to sit here for safety purposes. So I'm going to have to do what we're going to do right now. The second one is a single leg stance. And again, for safety, we're going to turn the chair around this way. So Dad, go ahead and turn face me. And come to the back of the chair right here. Okay? And what I want you to do is just with your fingertips, lay them on the top of the chair here for me. Move that out of the way. Great, thank you. Good. And I'm just going to have you shift your weight onto one foot and just lifting the knee of the other, holding right there. We're going to hold that for about 5 to 7 seconds. And you can see that a little bit of wavering back and forth. That's fine. We've got the safety here of the chair if it's needed. I'm a big fan of using a sink because a sink has something you can grip your hand over. Let's go ahead and switch legs, transfer the weight, and lift, keeping the chest elevated. I like using the sink because a sink has a lip that you can grab over. It's connected to a wall, and if you need to hold on to it, it's there. Good, down, and let's switch. So again, we're going to do 5 to 7 on these, keeping our chest elevated, our hips up underneath us. Our stance leg, we're switching. Go ahead, you want to switch? Not ready yet? Okay. And as we switch over, we want to make sure that the stance leg, our glute muscles, our butt muscles are really engaged nice and tight. And that's going to be what we call a pillar leg. We want to make sure that the leg is as strong as a pillar. We're going to do just a couple more on each side. Staying up really tall. Shifting weight from side to side. Making sure that our stance leg, our glute is very much contracted. You'll feel the foot pushing down through the floor. Let's do one more on each side here. Last one here. Excellent. Great. And our third exercise we're going to do is a calf stretch. So we've got a slant board here. Slant boards are pretty easy. You can get them on Amazon or at Home Depot or any of those kinds of places. You can also use a step, a single step, just hanging your heel over the edge of the step. So I'm going to ask Tony to come up onto the slant board. Our slant board has both feet. Has some sandpaper. I'll put 2 hands here on the wall, and the same rules apply. So we want to bring our tush up underneath us and our chest elevated. And if you notice, one of the things that Tony's done is he's done the secret cheat. And the cheat is, if you notice, the heel winks inward. So what we want to try to do is just that correction. Lining up the heel or the Achilles tendon with a second toe. And that will allow the stretch to happen there. Now this stretch gets held for a little bit longer. We're going to hold it. We're going to hold a stretch. So we're not going to come up onto your calves. Stay down. Stay in contact. That's it, and hold right there. This position gets held 30 seconds to a minute. If you're brave and you can tolerate it, 2 minutes, 3 minutes. And I'm going to step out and let Tony maintain the stretch for 30 seconds to a minute. In between each stretch, I encourage a little walk around the room. Come off the slant board, come off the step at home, take a little walk, come back, and then repeat it again. These stretches and these strengthening exercises should be done in a set of 3, anywhere between 5 and 7 repetitions. 5 and 7 repetitions can become 7 and 10 repetitions. Work with your physical therapist to slowly, periodically increase the resistance so that you can increase the success of your pre-rehabilitation or post-surgical rehabilitation. Why don't you go ahead and step off that. So the next exercise we're going to do is a transitionary exercise. It's the first one to prep on how to get up using your hands after a knee replacement surgery, and then from there we're going to actually show you how to get up after that. So the prep work is we're going to have Tony place his hands on the side of the chair, and we're going to have him use his arms almost like a dipping type exercise, using his legs and his arms just to press up and then come back down. And this exercise right here, keep going, is working the back of his shoulders, his triceps, his abdominals, and he's using his legs as assistance for his arms at this point. Even though he's had the surgery, he's getting some range of motion, he's getting some exercise flying into the contraction of the legs, and then the transition in order to get out of the chair is to shift the shoulders towards the toes, and then he presses up from there. Coming back down, he's going to look to where the arms go. You got to look, and then come back down. Come back up using your arms first. Press all the way up. Remember to look behind you first. Look behind you. Know where your arms are going to go first, and then find and slowly lower yourself down. Do it one more time. Use your arms. Press all the way up and hold right there. You can move into your mini squats after this. You can do single leg stance after this. This is all good pre-work to do to get ready to have that knee replacement surgery. If you know you're going to have it, this is what you're going to have to do right afterwards to get out of a chair. Learn how to do some of these things before you go in so that your recovery afterwards is simple and easy. Thanks, Tony.